Hello, welcome to Affiliation Options for Private Practices. My name is Andy Colbert. I'm one of the partners here at Ziegler. Been with the firm for 17 years, one of the founders of our healthcare investment banking practice. Came on in 2006 to help build out our M&A practice and have been working with private practices across the country on various partnership strategies, helping them evaluate the various growth options, be it partnerships, joint ventures, mergers, private equity, sale transactions, and have done a lot of work in the orthopedic and ASC space. Pleased to be invited here by Garfunkel for the annual ASC conference, and really excited to have a group of four distinguished guests here today. This is the affiliation options for strategic practices session, and really excited to be here today. And I'm going to let the guests introduce themselves. We'll start just with Andrew, if you want to give your introduction, then Geof, Mike, and Chris.
Yeah, thank you, Andy, and thank you, Garfunkel, for having us today. My name is Andrew Carlson. I'm actually an athletic trainer by trade. I'm the only non-ortho, non-surgeon on the call here today. My group, back in kind of pre-COVID era, Bluegrass Orthopedics was considering a path forward, and at the time, our group really had seen a lot of growth and needed to look in the future. And their decision was ultimately to go the private equity route. They looked for an investor that was very like-minded, and here we are today, 4 years later, and things are going well. And excited to talk today about our path and why we chose the route we went.
Thanks, Andrew.
So I think I'm up next. My name is Geof Thiel. I'm an orthopedic surgeon and one of the managing partners with a group called the OrthoIllinois out of the Chicagoland area. We started as a fairly large group. Probably we started about 50 years ago, and then we were about 60 physicians, fully vertically integrated, about 120 million in revenue. And we started to say, okay, where can we grow? How can we grow? What does the future look like for us? Had a lot of meetings with a variety of strategic partners, capital partners, ended up choosing to go forward with a merger with another large group in the Chicagoland area about our same size. And we completed that merger in January. It's probably about 4 years in the making. So the overall subsidiary now is Ortho Midwest. We're about 120 to 130 physicians, about 1,600 employees, about 240 million in revenue now. So we've had a lot of growth. But we certainly have had some challenges along the way, some speed bumps along the way. There's some great things about a merger. There's some really difficult things about a merger. And so there's a lot of discussion around that, but there's also a lot of discussion about where we go from here, because there's certainly some challenges in the marketplace and some challenges just that I think are inherently unique to physician practices in terms of the fact that we don't retain cash, in terms of how we finance growth, that we can talk through as we go through this webinar. But just happy to be here and looking forward to it. It should be fun.
Thanks, Geof. Mike?
Yeah, thanks, Andy. Thanks for including me. So I'm Mike Behr. I'm an orthopedic surgeon as well. I'm in Atlanta, Georgia, and I'm a part of OrthoAtlanta. I'm the medical director for the practice. And about the same time frame, 5-6 years ago, we started looking towards the future. Private equity was starting to come into the Atlanta market, and some consolidation was happening around the hospital systems. And so we started to do our strategy, and ultimately, because of the relationship we had with one of the hospital systems, which had been very strong for 20 plus years, we elected to go into negotiations with them to form a PSA. And it took us about 18 months. And in February of 2020, which was an interesting time to sign the agreement, because that was a couple weeks later, COVID became a reality and affected all of us. And we are now in our 4th year with this arrangement. It's a 10-year agreement. So far, it's been great. It has allowed us to grow. So we were 34 physicians at the time we signed the deal, and I think I just signed number 69. So in 3 years, we've almost doubled in size, which is pretty incredible. So a lot to talk about. There's obviously pluses and minuses with a deal like ours, and we can go into more detail in a bit.
Sounds great. Chris?
Well, yeah, thanks, Andy, and thank you for having all of us on the panel here. I think I'm kind of the bookend along with Andrew. So I'm an orthopedic surgeon in Washington, D.C., but basically we cover into Maryland, Bethesda area, and Northern Virginia. Our group decided to go with private equity several years ago, and the reason I'm probably a bookend is because part of our kind of history getting to this point is we looked at all of the different things. Specifically, one of the main ones was we were looking to partner with one of the hospitals that we had, relationships with for a long time. And in doing so, we spent several years. Ultimately, that didn't look like the path that our partners wanted to continue to go down. We had also looked at some other big groups around, but we ultimately decided, as said earlier, we needed a capital partner in this. We knew this was a fragmented market and there was opportunity to grow. And so we did a deal in 2018 and have now brought in multiple groups, a couple surgery centers, and are really kind of expanding that model out and continuing to. So.
Thanks, Chris. So maybe Andrew, we'll turn it back to you. You guys went through this a little more recently than Chris's group, and you guys obviously did a thorough process in evaluating your options. I mean, maybe give us a little background and history around, what in the group led to the decision to seek an outside capital partner. Some of the various dynamics maybe that you were solving for. And then, now as you're driving growth and really building this engine, what are some of the accomplishments that you guys have found so far, and what are some of the priorities and strategies as you go forward?
Yeah, thanks, Andy. I think all of us have done ample research ahead of making any decisions. And I think the group in Lexington, Kentucky, Bluegrass Ortho, they were facing some retirements. They were facing an opportunity that they felt like there was more market share to garner. And they were vehemently independent, like many orthopedic surgeons are. So they were discussions about what path to go down. Ultimately, they decided to partner with a private equity firm that they felt like was very like-minded, really as a partner for growth. Them being vehemently independent, they wanted a relationship that they could still practice like they wanted to. They still had the autonomy that they had desired at the time. They still have today. But if you look at what's happened over the last 3-4 years, a $25 million ASC expansion wouldn't have happened without a partner. Bringing 4 physicians on last fall would have been very challenging. In a 10, 12, 13 doc practice. And I think, for the most part, the physicians are pretty happy with the path they've chosen. But again, I think it has taken time to get comfortable. And I think every group looking at this should be well informed. And to be frank, I've talked to Dr. Behr in the past, and his arrangement is very strong and great for his practice. I don't think every market has a relationship with a hospital that he may have in his community. So I think each practice needs to look at their individual market and go slow and think through the process with good care.
That's great, Andrew. As you think about the new MSO that you formed now, Growth Ortho, certainly, at least from a name convention, brings the connotation of real growth and empowerment to independent practices. How much of the strategy is really growing across the U.S. versus regional versus local? How would you think about that and kind of comparing and contrasting the opportunity?
Well, great question. I would say that I didn't invent the name Growth Ortho, and thankfully patients aren't really seeing that name. It's just really, behind the scenes. Yeah, correct. I think any private equity sponsor is going to look for growth. Obviously, there's a lot of cases going to ASCs today. So for us, going from a 3-room ASC to an 8-room ASC, that's a pretty big growth initiative. And frankly, that project has taken about a year or 2 in the making to come to fruition, and it'll be open this spring. We have a practice in Austin, Texas as well, with an ASC down there as well. That group has also grown. And I think what's been nice on the recruitment trail is when you're talking to folks coming out of fellowship and they're looking for an opportunity to be in the private practice setting, they see an opportunity not just to have equity in that small practice, but they have equity in something larger, where as practices grow and as ASCs get added across the country, now their equity is growing. And I think that really helped us in the recruitment trail last year. And I expect that to really speak to some of the fellows coming out in the future.
That's great. And have you found there's some interesting learnings around kind of how medicine is delivered or how operations are managed in Texas that maybe is different than Kentucky, or there's kind of ability to leverage some best practices across different markets?
Yeah, I think, clinically speaking, correct. Absolutely. But I would say the delivery of healthcare, while is the same, is also different in each community. What works in Austin, Texas isn't necessarily going to work in Lexington, Kentucky. So we have actually formed regional centers of excellence across the country where they really are independent. So yes, they absolutely share best practices. And actually we're hosting a symposium next month where 3 groups are coming together and they're speaking to that. But we wanted to create an atmosphere where the practice remains independent and autonomous. In order to do so, you have to, yes, look for synergies and look for those clinical levers you can pull that to help across state lines. But in the end, if you start changing the back office and you start changing the revenue cycle and the culture of the practices, I think that's not going to work in the long term.
That's well said. So Geof, as you guys went down the path of a merger, effectively a merger of equals between 2 very large, stable, independent groups. It must have been quite a lift to build the inertia around getting the groups together. Maybe walk us through the process and how you accomplished it. One of the things from my vantage point that we see is, often without capital or an investment or some sort of liquidity event, it can sometimes be challenging to bring groups together and certainly of that size and scale. And so how did you guys go about bringing it all together?
Yeah, I think you kind of hit the nail on the head in terms of there needs to be that event for a lot of mergers to happen. And I think there's probably a good reason for that. We've done some smaller mergers. We've done a lot of organic growth, and we got to a size where we started saying, okay, is this meaningful growth, or how do we have meaningful growth going forward? We happen to have a very strong C-suite, a very strong physician leadership core that had a really good connection we merged with a group called Midwest Orthopedics at Rush, and there was a lot of crossover between the 2 of those. But with those smaller mergers, we knew that the idea of economies of scale, that our overhead's going to go down and all these other things just isn't realized. That's just typically overheads going up with a lot of these mergers. And, whether that's groups are running themselves well, and when you start putting more of them together, it gets harder to do that. We knew there wasn't going to be a lift from that standpoint. So it gets really hard to say, okay, let's grow strategically because we believe in the strategic vision, but we understand there's not going to be a tangible benefit for us at the end of this. It was much more difficult than any of us anticipated because we did see ourselves as similar practices, a lot of equals, but we still saw that going forward in the marketplace, at the end of it, we were going to be stronger. But it did take a good 2 to 3 years of really strong engagement. I think if you said, what would be my advice to people that are looking at merging, and there's a lot of discussion. I think across the orthopedic forum, which represents a lot of private practice groups around the country, there's about 70% of groups that have been or are currently in talks with either merging or some capital event or something like that. So it's happening a lot. And, I think that one, you have to understand that there's not going to be this big financial benefit at the end of this merger. You really have to believe in who you're merging with and understand that, you're doing it for strategic purposes. And then I think probably the most important thing is finding that right shepherd. the idea that we're going to do this together and we're going to work out these little details, you can never anticipate how many details there are and how many speed bumps there are. And you have to find that person that can take you through. Ours was good, not great. I think we could have done it better, faster, with a better structure in the end. But finding a partner that has done this before, that understands where you may go in the market, understanding how to create the foundations for an MSO that allows for a capital or a partner to come in a very easy way in the future is really important. So, I think the key point to that would be is physicians doing this over a dinner because you get along and you think your groups are similar isn't the right way to do it, and it's not going to work. But finding a person that can guide you through that process and understand the ups and downs is the right way to do it if you determine a merger is the way for you to go.
That's great. I mean, would you say there was some sort of kind of catalyst, if you will, that kind of just jolted everyone into thinking this was the right decision? Was it more just organic over multiple years? Because how would you kind of describe the process as well as building that inertia? Because I assume something like this probably takes at least a super majority vote across both practices.
It did. And I think there's a few catalysts, and probably the first and most important was fear. I think as any business, but especially orthopedic surgeons and subspecialty surgeons in general, the fear of missing out or the fear of not understanding something is really powerful. And, I think our fear was, okay, we're all doing really well. We have very strong positions in our current marketplace. But if we just, turn our shields outward and just stay where we're at right now, what does that look like 5 to 10 years for us? And we all agree that there's an inherent risk in not trying to do something, because as the marketplace changes around us, we may end up being totally succumbed by some other large group where they were really rapidly trying to grow. So the fear of not being part of this movement of getting bigger was certainly probably the most important catalyst. And then we all recognized, I think the two other things was this move to, it's a catch-all, but this value-based care, or the idea of population health, or, this idea of managing large patient populations and the value that can have was another reason that we recognized we couldn't do it. Even though we were large, we weren't big enough. And then the third was we also recognized we would be more valuable to the marketplace the larger we were. And we said, you know what, we could each do our own independent transaction right now and probably do pretty good with it. Or we could look at creating an entity that has the possibility of being a platform sort of organization for additional growth that, at least in our vision, whether it was naive or not, made us feel that we may have more control of our own destiny if we've already created a platform that we're growing for, as opposed to being a cog in the wheel. So number one, fear that we have to do something in the marketplace to get bigger. And then two was the fact that we could create this entity that may have more value, and then three, just how we can do things better together. But, those are kind of the reasons why we did what we did. And, I think this was just phase one for us. This is not where we see ourselves sitting for 10 years. This is, okay, now we've created it. What do we do with this? Which is a totally different conversation than what we were having within our own groups. And, we can get into, where we're looking to go in the next few years, as we go through this.
That's helpful. And have you guys, in going through this process, did you guys put any thought into more of an MSO model? You hear a lot of groups in the countries, some of these big groups coming together, forming MSOs. Feels like that's a very popular strategy right now. Maybe walk us through, what you feel like this brings versus, if you had just decided to set up an MSO, maybe moved some assets into an MSO, but kept the two practices more or less independent.
Yeah, so that is the eventual plan. There is an MSO that exists between us right now, but I think as physicians, we said, well, why can't we just do all of this right away? We had this great idea 4 weeks from now, let's have this fully integrated group. And, let's hit the gas on this. And, after meeting after meeting after meeting after meeting, we realized that's not quite how it worked. So this is a walk before we run sort of merger. We all came under one tin right now because we were able to contract better, and we saw some lifts that we didn't think we would see with contracting being as large as we were. There's currently an MSO that exists between us that we're slowly moving things into. So things like back office, revenue cycle, some things that aren't necessarily site specific. But there was a lot of apprehension from what we saw as key players in each organization as to, okay, we're merging. What happens to my job? Where do I go? And we really need to keep them engaged. So we have an MSO that we're slowly filling. Right now, being two integrated organizations, there's not a huge value until we decide to do something as our next level to have a fully functioning MSO. And then the ultimate goal is a fully integrated merger, but that's when, then comp plans come into play, EMRs and all these little things that sound simple, but in reality are probably the most complex things to go through. I mean, just changing a comp plan to be similar between two orthopedic groups. We do a lot of work through ortho forum groups, and I would tell you that I haven't talked with 10 groups who have comp plans that I would even say are similar. Everybody's kind of gotten to their place where things work well, but you push one domino down and a whole bunch of them fall. So right now we've integrated, we're negotiating under one tax idea. We have the ability to make big strategic decisions as one entity, but we still function somewhat independently on a lot of day-to-day stuff that as time goes, those will become integrated as well.
That's great. Yeah, and probably time to kind of build the consensus amongst folks as you prove out the success and kind of gradually bring the organizations closer and closer to, I imagine eventually it's basically, one entity that's holding all the employment agreements across, both organizations and one consolidated profit statement, if you will.
Yeah, I mean, the hope is we're under one EMR, which is like its own lift in and of itself, but has tons and tons of different things from a back office standpoint that we're really limited by not having that. But it's not easy moving 200, when we take out not just physicians, but 200 providers on one side onto a new EMR and 800 employees. There's a lift to it. So with time, we're moving there with time.
That's great. Well, thank you. Mike, if you could just walk us through your group strategy, as I think Andrew alluded to, the PSA option may not necessarily be available in all markets. And, it's something that I'm not sure I hear a lot of groups thinking about or understand. So I think maybe, give some background on maybe the strategies you guys evaluated, the different paths, why you decided to go down the PSA route, and what it really means to the practice from a true independence and structural perspective.
Yeah, so those are all good questions. So just going back a little bit further in 2002, when there were 7 of us that had all come out of a practice, so we were all practicing orthopods at the time. We created what is now OrthoAtlanta, and at the same time, we created a separate tax ID'd MSO that we hoped someday would be an ancillary for us. And really, for the next 15 years, it served as the primary engine for OrthoAtlanta because we did organic growth to about 34 physicians over the next 15 years. When we saw and looked ahead in around 2015, 2016, and saw consolidation and the things that were happening in our market in Atlanta, we were fortunate to be within a hospital system and had a lot of experience with that system to create a relationship that we thought could go much longer and be much deeper than it was. And so we started negotiating in about 2016, 17 to form this PSA. We saw it as opportunity to do a couple things. Number one, stability. We wanted to grow, and so growth was something that we had done all along, but it's expensive to grow and only getting more expensive, so we needed the capital to do that. We elected as a practice not to go private equity. We had those opportunities in the 90s. We had it again starting in 2015 up to the present time, and we wanted to maintain our independence. And so the PSA sounded like a good model. So we hired some outside folks to come in and guide us through the process, help us with the negotiations. And essentially, it has done what we had hoped it would do in that, again, we've doubled in size. So the capital's certainly been there to help us grow the practice. It's been organic growth, which we like. We've had very few mergers with other practices. There's been, I think in our entire history, maybe a group of 8 that came in about 10 years ago, and a couple of very small groups of 1 or 2 that have come in, which makes those transitions much easier, because when cultures clash, it becomes very complicated. And then it really has provided us with a hospital system that has a huge clinically integrated network. So we have a referral base that's built into the system. We built an exit strategy into our negotiations in case it doesn't work, because you never know when something's going to go south. And we renegotiate our RVU rate that we have with them on a 3-year basis. But we put some very strict guidelines on that as far as a floor, so they can't come in and say, you're doing great, but we're going to cut you in half this year. So we really try to protect ourselves, and yet we have a practice that is managed by a group of executive orthopedic surgeons, and they make all the major decisions. So we really have been able to keep our independence in what we do. And it's not a perfect world, like everyone said. It sounds great, but anytime you tie yourself to a hospital system, things slow down quite a bit. And we knew that going in. We knew that would be a challenge, and that's a constant effort on our part to try to improve and make that more efficient. But overall, going into halfway through our 4th year, we've been very happy with it.
That's great. Is there a big focus on building new sites of service in addition to adding physicians, or you're mostly adding physicians into current sites of service?
Yeah, that's also a really good question. So a couple of points with that. We're fortunate, again, that the hospital we belong to realizes that the world has moved outpatient, and to survive as a system, so they don't consider themselves a hospital system anymore. They now are a healthcare system, and part of that is their outpatient presence. And so any outpatient surgery center we have going forward, they will be 51%, will be 49%. We want them to be 51% because they have the rich contracts. They have 22 hospitals in their portfolio, so a lot of strength in negotiating. But our guys can still invest and be equity owners in those centers. So, and then they have the largest urgent care footprint in the state, which is, again, a very valuable source of referrals for us. So it's worked out from that standpoint. It's worked out well in addition. That's
great. Yeah, I mean, it seems like this is a system that really understands the long-term play of moving procedures to a lower cost of care, even if the short term they might be sacrificing some revenues doing that, which isn't necessarily the case with all systems.
Yeah, it was a hospital system that was started by physicians, and I think that had a lot to do with their culture and us being on the same page. We're always skeptical, though, and looking forward that something may change. Different ownership, hospitals change hands, all those things. So we still have to be very careful on how we progress and not get too lackadaisical on how we approach this.
And in going down this path, Mike, was it a relatively smooth sail in terms of getting your partner's approval and getting the required votes? Were some kind of pushing in different directions? How would you describe that process?
So we did a really good job with that. The hardest sell was we sold our physical therapy, and we had, I think at the time, 14 physical therapy locations, and that's a pretty rich ancillary for orthopedics. Some of that had to be turned into part of the RVU negotiation. So none of us were going to make a deal where we're going to make less at the end of the deal than before. But we had 100% approval at the end. And if you ask our surgeons, they didn't see much transitional change. And from their day-to-day practices, the biggest one came when we converted to Epic. And as Geof said, anytime you change an EMR, it's significant. I don't care how good the EMR, whatever. It's a huge hit to your practice, your day-to-day practice. So, but we got through it.
Great. That's great. Well, exciting to be moving and seeing that kind of growth doubling in size is no small feat.
Yeah.
Chris, do you want to walk us through your group's trajectory? You guys were certainly one of the earlier players to partner up, and it feels like you guys have maybe taken more of a regional strategy to growth, which maybe is a little different than some of the more national focused growth models.
Correct. Yeah. Well, I'll echo some of the things that people have said. I mean, part of the thesis when we started this was that, and just as alluded to, and I think you're going to see this from any physicians that you talk to, most people are running good practices. Most people are doing well, but there is this sense of, I need to get bigger. We need to compete in this market from a contracting standpoint, obviously insurances, whether it be MSO or how do you compete in that? And we also, again, I think just as Geof had alluded to, we're doing fine, but we also know that over the next 5, 10 plus years, is a 10, 15 person group going to start to get rolled over by some of this? And so we had looked at that kind of concept early, as I alluded to earlier. We, just like Mike, had a hospital that we still have the majority of our business with. But unlike Mike, this hospital is not, just as you alluded to, it's somewhat enlightened about kind of the future and partnerships with physicians. So, as we started these negotiations, which we thought we were kind of, going to be relatively private practice in this new system, be getting better contracts, those over a multi-year timeframe basically devolved. And at that point, we realized there wasn't a long-term partnership with the hospital. We saw, as I alluded to earlier, a lot of fragmentation in the market. There was not a big healthcare system, unlike Chicago, in the Washington kind of greater regional area. There are no major, or at the time there were no major groups that were 60, 100 docs. And so there were a lot of what we saw as ourselves, basically 10 to 15 person docs. Probably the best docs in the region were all siloed in these practices. And so we saw that fragmentation and saw that there was an opportunity. And then, like Andrew had alluded to, all the physicians really didn't want to lose their autonomy. And I think you hear that concept out there consistently. Everything, as alluded to, has negotiations. There are always going to be pitfalls and things that you can't think of. But we knew that if we, for our particular healthcare system, if we partnered with that system, things were going to dramatically change. And it's not just EMRs, it was across the board. And when you talk about that supermajority, no one was willing to go down that path. We had robust ancillaries, we had physical therapy. No one was really willing, because we personally, quite honestly, didn't trust that they were going to be able to fulfill, the value add that we were looking for. As a result, we knew we needed capital. You can't do this without capital, as alluded to. And so we then, went down the private equity line. And so we basically shopped to private equity. We then chose a sponsor, and this was basically the end of 18. And so 19, we spent time kind of building the backbone of what would be the MSO, changing certain things around from revenue cycle and just getting it ramped up. We then hit those years of COVID, which were obviously a little bit of a delay because we were about to get going with some of the M&A at that time. But then over the last couple of years, I should say, we've really ramped. So we started out at about 13 docs, and we're up to about 65 docs now. To answer your question specifically, we have made a conscious decision to say somewhat regional. We are not looking at groups in California. We are not looking specifically at groups in Colorado, because we do think that there is some synergy that can be garnered from a regional aspect. That being said, that is not just our local area. We have a practice down in Virginia Beach. We're certainly looking throughout the Mid-Atlantic region overall, because we think that is the value that we bring. And then the last is, when we look at groups and when we look at, what we bring to the table from an equity standpoint, again, most groups that we talk to, I mean, there's obviously groups who are not managed well and not doing well, but I don't think anyone on these calls is really, looking to partner with those particular groups. These are always groups that are well run, have a long history, and want to continue down that path. So just as mentioned, we don't want to change a lot about the practice and the culture. We want to develop some synergies that are out there. But really, the other aspect is that every group has some void, whether it be physical therapy, urgent care, something. So our goal is never to go in and tell a doc that you need to do double the work, or whatever it may be. That's not going to happen. We all know that that's not how you gain value in the system. but all of the different entities that are built around, whether they be surgery centers, physical therapy, DMEs, you name it, urgent cares, most good groups have some opportunity that's built in. And again, if we can come in with capital, as alluded to by Andrew, building a huge surgery center, that's a tremendous value add for all the physicians in that practice. And so whether it be physical therapy, whatever it may be, we've found some of the greatest opportunities in physical therapy, and we've got some great people that really know day one how to get that therapy up and running, look at not only real estate, contracting across the board. And so again, that's where we think that we bring the value, because all of these practices that I think everyone on here that's looking at partnering with, they're all typically well-run practices. They're just maybe some value that any particular model that we're discussing here today brings to that group. So
that was really helpful. Maybe one area that I'd love to dive deeper into when we talk to private groups is always this question of what does this mean for new recruits, new partners in the future? I think people understand the concept of private equity for the current owners and there being a nice liquidity event and ability to take some chips off the table. But what does it mean for folks that are on partner track? And how do you guys think about demonstrating value to them in a way that still keeps them excited and gets them to want to continue to stay involved and engaged?
is that, I'll take that.
Yeah, maybe start there, and then Andrew, if you want to chime in.
So I always start this conversation as the world today is different than when I joined my practice 18 plus years ago now. At that time, I think we all were familiar with whatever the comp models were, but they were basically some version of eat what you kill, that you paid your expenses, and then, typically over that, you were taking, the remainder home. However you divided up expenses with your partners was all individual. That world has changed. Residents and fellows coming out now understand that, as we know by the numbers, the majority of physicians of any specialty, a little less in orthopedics, but most other specialties, almost 100%, go into healthcare systems and are basically paid out on an RVU basis with potentially some bonus on that. So the world has changed in that capacity. In that model, we see that, or that was part of the conversations that we had, is that we think that that particular physician in orthopedics that's coming out, that is getting basically an RVU set across the board, is generating a tremendous amount of revenue for that healthcare system, probably not participating in that revenue stream, essentially. And that includes everything that we just talked about: the physical therapy, the surgery centers, even for them, it's all the x-rays, the MRIs, and everything that are generated through their patients, that they're truly just getting the value that they see the patient and maybe the surgery that they perform. And so in that environment, having a system where not only do you have basically security, you have, all the back end stuff that we were all worried about of, running a practice and everything, which I think is a big fear for, new grads coming out. But now someone has the opportunity to not only garner their surgeries and the value that they get for seeing their patients, but now being part of the equity model that, again, twofold, not only having equity in the MSO and into the system, which obviously is hopefully going to grow over time, and they're going to be part of the future events on that equity, but also sharing in a pool of ancillaries is how we've developed it. And I think most probably are in the same model, that we have a large ancillary pool. And then again, new docs are coming into that ancillary pool. And that is not only providing distributions, on a monthly, quarterly basis, whatever it may be, but also having equity into the larger platform for the future. That's how I kind of see new grads coming in. When you look across talking to other groups, you almost have a bell curve of groups. You have the young grads, which we just kind of talked about. You have the older docs who are obviously very excited to get some event and walk out the door soon. So you have to kind of play those off of each other a little bit. And then you have the middle docs who basically have a practice that is, fully up and running. And those are actually the easier ones because they still have time in the practice. So you don't need to kind of, neutralize them one side or the other. They have a fully mature practice. And so they're going to get not only in potential equity events, but also future earnings down the road. So
that's great. Andrew, anything you'd want to add to that do you guys see the world similarly different
Yeah, I think you made great points there. I think whichever path either new physicians or established physicians go down, you have to understand you have to backfill. There are retirements coming up. You have to be able to recruit behind you. So the doctors in Lexington, when they chose to go down this path, they were only comfortable knowing there was a pathway for those who are in residency and fellowship to have equity in growth ortho. So just assuring that each path you have an outlay for new recruits is important. Again, I know we're coming up on time. We can talk at length about new physicians. There's a lot of options out there for new docs, more so today than ever before. And it's a whole other webinar, to be frank.
Yeah, no, appreciate that. And I think in closing, what I'd love to do is just get some closing comments for each of you on just, what advice would you give to a group that was sitting in your shoes, but going through it today for the first time? And maybe Geof, we'll start with you in terms of just now that you've gone through this merger process, if you were doing this for the first time now, what advice would you give?
Yeah, I think I'll give you two, one for our past and one for we see our future. So one, the past going through a merger, I think trying to do it on your own is too difficult. You need a third party that's able to have objective, difficult conversations with either both C-suites or both physician groups that can guide you through the process that has a roadmap. So a third party that has a roadmap is absolutely critical if it's going to be successful in the end. I think going forward, I think we probably have met with every private equity group that's out there in terms of both organizations. And for us, we've learned organizationally, it's not a multiple question. It's not a financial question. It's a partnership question. So our next phase is going to be more around finding strategic partners and less about a capital component to it. And, that'll be a secondary component, but the primary is going to be who has the bandwidth to give us what we don't currently have to take us to the next level where we see orthopedics going.
That's well said. And that probably could be in the form of board members and advisors and just smart people around the table, probably to kind of make sure you guys are making the right decisions. That's great. Mike, what would you give in terms of advice to a group going through the process that you guys went through, and any lessons learned that you might be able to give folks to maybe speed things up or get through this quicker?
Yeah, I guess a couple of real quick things. One, I probably wouldn't try to speed it up. I think the devil's in the detail, and sometimes we rush to get these deals done too quickly. We took 18 months and we still could have, in looking back, dotted a few more I's and crossed a few more T's. So I also think the outside expertise is invaluable. Not just one, but you need someone for fair market value. You need the legal help. You need the other experts in these areas. And you want it separate from the partner that you're dealing with. You don't want to use, obviously, their outside help. And then third, you got to have the right partner. I mean, it is just so important. And well, we were lucky to have a hospital partner that we could choose, but that's not going to be available for everyone. And the last thing you want to do is get into an unhappy relationship with a hospital system. So you do want to be very, very diligent in how you pick your partners.
Well said. Well said. Hard to get out of if a couple of years down the line, it's not what you expected. Andrew, what advice would you give, now that you're looking back a couple of years into this partnership?
Coming from the growth guy who likes to move quickly, I think everyone has said it. Move slow, do your research. These are marriages. It's not a speed dating process. So seek outside counsel, seek quality advisors, and take things slow. I always say you got to go slow to go fast. And I think that's important in this case.
That's great. Chris, from your perspective, any lessons learned over the past few years?
Well, I would certainly echo, obviously, most practices and most physicians haven't done something like this before. So obviously we all need help. And that's, why there's a consensus of kind of get good lawyers that have, been down this path, get advisors, whatever it may be. I would also say internally, that's all the external stuff. And I think that makes a lot of sense for everyone. But internally, if you have one of the things that we saw with ourselves and that we see with other groups that we talk to, there should be a couple of partners in the partnership that are trusted partners who probably the reality is somewhere in the middle ground that will continue to move the ball forward. If you're a group that you have 13 different opinions and everyone is pulling in a different direction, nothing's ever going to happen in my mind. And so, if any group wants to go down this path and wants to do diligence, and who knows where it ends up, you really need to have a couple of your own partners who are really leading and spearheading this. And again, I think on this panel, you're looking at 3 different models that are very viable in this particular world right now. And so someone who's really going to spend the time, do the diligence, look, do we have a good potential healthcare or hospital partner? Are we a mega group that wants to join with another mega group? Do you want to go down that private equity line? But if some group is just throwing it out there and everyone has kind of got a different opinion of it, nothing's ever going to happen. So kind of sit around a table, pick a couple of people that really have the time and can move the ball forward, and then do the diligence on all this. And if you do, then I think you'll probably make the right decision. Of course, you're going to get counsel. Of course, you're going to get all those things. But you people as a group have to come together and say, we want to do something, and we're going to put in the time to make what we think is the right decision, whatever that may be. Yeah.
That's great. This is really great insight. One of the things that I often counsel groups is, often what's overlooked is really starting with just a strategic objectives analysis. A lot of times I find groups rush into the courting process and the meeting new parties before really coming up with their own fundamental set of criteria on what they're actually looking for. What are the true needs of the group? Where are the holes and the gaps that they're trying to fill? And what is it that makes an ideal partner, right? Is it capital? Is it strategy and insights? Is it value-based care? Is it referrals and better rates? And I often find, people kind of skip that step and rush right into just starting the interviewing process. And I really try to counsel groups to start with that really internal analysis, put that 5-year plan together of what do you think the group looks like on its own today, and then what's the deviations if things go well or don't go so well, and at least have a framework and a benchmark to then compare as you start having these discussions. And that's something we often really enjoy doing with groups. And then when you do start the external conversations, you have a set of criteria to compare it against. But this was all really phenomenal feedback, and we could probably keep going all day on this. I know we're out of time. I want to thank all of you for your comments, and I'm sure we're going to bring a lot of great insights to all the participants here. Andrew, Geof, Mike, Chris, thank you all. You guys have been so generous with your time, and really appreciate it, and look forward to continuing the discussion.
Thanks, Andy.
You.
Thank you.